Hello and good afternoon. What a fantastic day today has been to see all of the fabulous work that's going on across Scotland. And I think that gives us a real sense of hope, a sense of inspiration going away from here that we can do things better because we do have many challenges. We started today hearing from our Cabinet Secretary on the evolving reform agenda. I think that in itself is quite exciting, and also the fact that we can also hear from him his plan to involve all of our voices, the voices of clinicians and the voices of the people that we serve, and that in itself is absolutely critical. But during this session, we'll be going through hearing, as Alistair has said, a number of examples, and today I want to just take you through a sense of the what, the why and the how of how we're going to go about this. The theme that has run like a golden thread through everything today is doing things differently, transforming and reforming our NHS with innovation and with digital opportunities just as a part of it. So it seems fitting at the end of today to be finishing on this session. So how do we drive reform? How do we accelerate that innovation? Well, first of all, and I come back really intentionally to this because always at the very forefront of everything that we do and at the heart of our work is the citizen and the patient needs, but also, of course, our staff needs. But what is really important is that we have that reform ambition. We have a vision of where we're wanting to go to. We have clear strategic plans. We have a financial imperative and strong financial plans. But also, importantly, we have clinical need and ambition to do things differently. As Alistair said, I stand today on behalf of Board Chief Execs, and the Board Chief Execs are really committed to working together in a very collaborative way, along with COSLA and other strategic partners across the digital health and care landscape to make things better and to come together to be greater than the sum of our parts. I think this is a moment in time of genuine alignment. And an alignment because the compelling need for change is here. We must do something different. We're all very, very clear on that. And now there is a will and a vision, and digital innovation will play a really key part in that. So briefly, the why, the what, and the how of this. So first of all, the drivers for change. We've heard again this morning about that vision to enable people to live longer, healthier, fulfilling lives. If we start from population health, and I make no excuse in pausing for a moment or two, just to talk about the challenges in mortality and healthy life expectancy in Scotland. Healthy life expectancy, living with a quality of life, is now for a male in Scotland on average about 60.4 years old. But in Lanarkshire, where I work, it's 44.9 years. That feels absolutely heartbreaking and something that we need to do something about, not just for the people we care for, but that disparity across different parts of our system is absolutely compelling. And we need to be able to co-produce, give our citizens that opportunity to work differently. We also need to manage our demand in a different way. We know that there's a mismatch between the capacity that we have and the demand that is coming through our door, but more capacity isn't the answer. So we need to evolve the how. We need to look at improving the value, the affordability and the outcomes. And I'll speak a little bit more of this in due course. We need to reform how we work. We have significant workforce challenges across the landscape in terms of not having the optimal capacity or capability at times in our workplace. And the experience for our staff, particularly over the last few years, has been challenging to say the least. We want NHS to be a great place to work, where people want to come to work and stay because it feels good, they feel part of something, they feel valued, and they go home feeling fulfilled. And so it's important that we give them the tools and the setup and the systems to be able to do so. And finally, we need to reform our systems and our services, earlier intervention, that shifting into the community care that our Cabinet Secretary and Director General spoke about earlier, reforming our model of care. And so what would be our key priorities? I think it's an absolute imperative that we give our citizen access to health and care data. We've talked about all the information governance challenges that exist, but if we empower our patients and citizens themselves to have access to data such as their conditions, their medicines, their appointments, their test results, so that they can ask whether they have the education, the privilege of education that we in this room have had or not. We also need to have a more nationally cohesive system so that there is parity across our country in terms of digital systems. We need to have more coordinated and agile deployment of systems, and again, the parity of the versions and the investment. And finally, of course, the piece that we hear over and over, we need to support care to be closer to home. So how do we create the ideal conditions for success? Well, the fact that you're all in this room and that we're standing here actually says we've taken the first step. There is a real commitment, and our reform agenda from our Cabinet Secretary and Director General say similar. In terms of that public and professional access to data and information, it is absolutely essential that we move at pace to break down some of our digital barriers and give our professionals access to information to do their jobs better. And this is across, of course, health and care. We need to accelerate that adoption of the digital innovation. When it works, we spread at pace. And of course, there's many good examples that we've been seeing today where that is happening. And many of our national boards are also doing fabulous work in this space, but we need to do more in terms of the technology and the pathways. And we need to harness our clinician and citizen voice, as I've said already, to make sure that we stay in step. But together, with national collaboration and real partnership, we can move to genuinely what we've often paid lip service to, a once for Scotland approach. So just to give you a sense before I finish up, in terms of what this might mean in terms of that patient journey, home to home, with our GP, ambulance, front door and hospital system. The pressure points that we see right now, certainly in my own system, GP access is a particular challenge because we have got a particularly low number of GPs relative to other parts of Scotland, despite our deprived population challenges. And the management of really complex conditions can be a real onersome burden for colleagues, and we need to find different ways of helping to manage that. So when patients don't find the access solution they want, then they push the demand to the wrong space and place, and we don't follow that right time, right place, right person. So we have unscheduled demand hitting at the wrong time and perhaps a little bit later in the curve than we would want the problems to arise. We then have onward A&E access challenges, and we understand when the burden in our system becomes greater, then we don't always make the decisions in the right place at the right time that we would otherwise. And then, of course, we've had focused discussions today and parts of the conversations around the length of stay, the extended lengths of stay, the delayed discharges in our system after patients are clinically ready for discharge. We don't always act in a timely way. But there is opportunity. There's opportunity for us to monitor in different ways and build the other two ends of the pathway. And if we can do that through pathway redesign and through digital redesign, then we can increase care at home, we can improve the access and indeed performance of our system, we can improve the experience for our patients and their families, but also really, really importantly for our staff. And overarching, we will improve the outcomes for the people of Scotland. And what are the key digital opportunities that lie there? The digital front door, an evolving concept that's sitting in the system at the moment that we're looking at that might well, within the next year, 2 years, give access to our patients and citizens to their health conditions, to their medicines, to their appointments, an ability to change. But all of this, of course, needs further work and further commitment. In terms of virtual beds, Lanarkshire, like others, are looking at virtual beds at the moment as a key part of this, to look at patients in 4 cohorts. The patients who are in the GP practices that could do with additional management, the patients who are potentially imminent admissions, the patients who are already clinically ready for discharge and we're looking to discharge quickly, and then those with long-term conditions who could be managed in the community, such as the heart failure patients, etc. And we're about to contract into buying 200 to 400 virtual beds to try to reset and rebalance our system in a different way. E-triage at our front door in our A&Es, because many of our A&Es are very busy and the staffing challenges in that space makes it difficult to get to the right patient at the right time. So e-triage lets our patients book in digitally and be assessed and triaged at a first level with nurse then further triage to follow. But it lets our clinicians know that there's no one sitting in the ambulance queue or in the waiting room that they haven't got sight on in terms of their needs. We also have a variety of other models that we will develop. In Lanarkshire, we're using FNC Plus as our model, but there's variations across the country. For us, this is flow navigation, plus adding in the virtual wards, the outpatient OPAT services, the hospital at home, etc., etc. It's about trying to create a cohesive hub which will make all the clever connections to help our clinicians and our patients navigate our system more effectively. And then finally, the wearable tech that will go onward into the lives of people as they return home. Some really significant opportunities, and these are just the tip of the iceberg. But of course, connected to all of this is that we must have a nationally cohesive system that deploys, as I've already outlined. If we can achieve all of this, if we can have the ambition and the courage to move forward, then I believe that we can achieve genuine citizen empowerment, true collaboration across Scotland and a once for Scotland, a cohesive digital core on which we can hang different opportunities as AI and other technology develops, and a really person-centred approach. But we must have ambition and courage to do so. But I wanted to leave you with this final quote about the biggest part of digital transformation is the way that we think. Well, today I think we've all been challenged to think in different ways, seeing examples from across Scotland, and I hope you, like I, am feeling inspired by that. But I'd ask you to go away today and think about in your area of work. Where could you start to harness digital innovation? How could it help you to accelerate? And how do you create the conditions for success locally to start on that journey? Thank you very much.